Hey, Zane Griggs here. So, can you guess what kind of diet that some doctors, very progressive doctors, are using to reverse diabetes and help people recover their insulin sensitivity? Huh? Can you guess? Can you guess? I bet you can since you're here on my page. It's a high fat, low carb diet. Good news, right? That some doctors have actually caught on and are treating and reversing diabetes instead of just treating it with giving people more insulin or other, blood sugar reducing or controlling drugs. They're actually getting them off their meds and getting them back to normal, have normal insulin sensitivity, which basically means their blood sugar stays below 100. Okay, so if you've got a fasted blood sugar test, they give you that glucose thing, it goes over 100 if you're insulin resistant, it stays below 100 if you're normal. And really, what's fascinating, I was listening to this fat summit that Dr. Hyman is hosting, and I was listening to this doctor who's her name is Sarah Halberg, and she's a doctor she has three specialties: obesity, she's an internist, and a lipidologist. So she deals with people's cholesterol and that kind of thing too. So she's not recommending high-fat diets and it's going to cause them risk of cholesterol. She actually is quite the opposite. But I'll come back to that. 100 gram or 100 blood sugar, okay, rating. So if you stay under 100, that's actually only about 5 grams of sugar or a teaspoon of sugar in your blood at one time. If you have more than that, if your body can't get rid of what you're eating fast enough to get more than that out of there, you go over 100. And when you start going too high, we risk, if we don't get rid of that with insulin taking that and shuttling into muscle cells and fat cells, then we go into the diabetic coma, right? If we kept just eating and all that blood sugar built up in our blood. So it's got to go somewhere. But insulin resistance is when muscle cells and then eventually fat cells are no longer responding to insulin, which is what shuttles the carbs into muscles where it can be burned or fat to be stored. And it's usually muscles first. And so if the muscles shut down or are resistant first, it goes to fat cells to be stored. And then so you could be gaining fat storage. You don't have access to it because insulin is high all the time. And then so you can't burn it. Or it puts into muscle cells when you're insulin sensitive, you can actually burn it off as fuel and store it as fuel. So this is the important factor in metabolic disease right now is insulin sensitivity or insulin resistance. So the estimate, and this is according to this doctor, the estimate is that about 50% or more, slightly over 50% of our adult population is either diabetic or pre-diabetic. Now, if we're talking about just simple, she said simple insulin resistance, so on their way to pre-diabetes, so whatever that means, but just start moving towards that think of a sliding scale of insulin sensitivity over here, diabetes way over here, pre-diabetes here, so insulin resistance somewhere in this scale range, so where you're moving towards that pre-diabetic place, is probably over 75% of adults. So chances are, there's over 3/4 of us, okay, have some insulin resistance, which means you're going to see weight gain, carrying a little extra weight. You just don't respond well to sugar anymore. You don't put it into muscle cells like you should. So that's most of us. So that means most of us need to think about this. As we get older, it only gets worse. It gets more difficult to process those carbs. We don't process them like we did when we were, high school and college. It gets a lot more difficult to turn them into fuel. We end up just storing as fat. So what can we do about it? What does her diet look like that she's recommending? Be more specific. She recommends at least 50% of the diet come from fat. So you can't, most of us can't just shoot from the hip and hit that, right? Unless we're used to tracking food or we've tracked our food before, we know what that's supposed to look like, and we know how to cut our carbs down and add fat. So you're probably going to have to use a food tracker of some kind, some sort of app probably, to determine how much percentage of your food is coming from fat, carbs, and protein. But at least 50% coming from fat. Carbs stay really low, primarily veggies, stay away from starchy veggies, stay away from starches and sugars, obviously, including fruit. She actually limits fruit to being berries, and that as a garnish or something kind of on the side, not the main course, because they are the lowest glycemic. They have the lowest impact on blood sugar. But berries as a garnish, not the main course, but mostly veggies. And never eat your veggies without fat. So, which a lot of people kind of go, what? We know better, but a lot of people come in who've been told, stay away from fat for so long. They've been hearing this dogma. Put some cheese, put some butter on that broccoli, on the asparagus, on the Brussels sprouts, right? Cook it in coconut oil. Throw some olive oil on your salad. Butter, good stuff. Butter on veggies, yum, right? So I even put it in my coffee. So it's increasing fat to offset the carbs for fuel, because we have to have some fuel, and just we feel better, more satisfied, our hormones work better, life is better on fat. And it does not, because she's a lipidologist, she knows how this affects cholesterol. And this was really fascinating. I loved hearing this, because it's something we know, but to have a doctor kind of break it down and come out and say that, you know what, carbs, overconsumption of carbs is actually what puts more saturated fat in our bloodstream than eating fat does, because of the way it hits basically our chemistry of how it affects the LDL, right? And how many particles is actually, not to get too sciencey on you, but here's what she said. Your total cholesterol and the typical LDL number, the LDL-C that we get in our cholesterol tests, is about as useful to her in determining your risk as your hair color. So her words, not mine. Typical LDL tests, total LDL and total cholesterol as useful in determining risk as hair color. So basically, not useful at all. Now she does another test which looks at normal number of particles. So basically what she's determining is whether they're the light, fluffy, fewer of the light, fluffy, larger particles or transporters that are of cholesterol, or they're those mini, small, dense ones, okay? And the mini, small, dense ones is usually what's caused by eating carbs. When we eat high fat, we have fewer of them, and they're big and fluffy, and those are not what causes the problems. So that's a very simplified version of what she said. But basically, the high-fat diet does not doesn't have a negative impact on triglycerides, on our cholesterol risk, or the risk that could come from certain types of cholesterol. Okay, but overconsumption of carbs does. So the opposite of what we've been told by government and the medical industry for the last 60 or so years. Something to think about. So add those fats in: avocado, butter, cheese, olive oil, coconut oil. Find ways to add this to your diet. Reduce your carbs, mostly coming from non-starchy vegetables. Okay, limit fruits, and obviously limit sugar and starch to as little as possible. Special occasions, special treats, or maybe some if you have tough workouts. Some of you guys, post-workout. But if you're dealing with obesity, insulin resistance, you're pre-diabetic, don't worry so much about it. Keep it low. The first priority is not building big guns, right? The first priority is get our blood sugar in line, start burning fat off, getting to a normal weight or a good weight, and getting insulin sensitivity back, so that our body, so when we do eat those carbs and we do have our workouts, everything responds as it should, and we're turning those carbs into fuel that we can actually use instead of storing them away, where our bodies won't let us access them as fuel because our insulin is too high. So a little in depth, a little longer than I thought I would go. But so if you have questions, feel free to comment below or message me. I'm happy to answer questions. And if you know somebody that needs to hear this, that maybe is a little bit confused on the whole high fat, should they be worried about eating too much fat or eating too much carb, and they're not really sure, tag them below in the comments and let them know. I'm happy to answer their questions if they have any. So have a great weekend. Find some fat, go get some avocado, and I'll talk to you later.